Hi, my name is Duong Truong, or you can call me Sunshine. I'm a student of Master of Public Health and Master of Business Administration dual degree at UAB. My concentration is healthcare organization and policy. Due to COVID-19, I have opportunities to experience a remote summer internship. The vision of my MPX internship placement supervised by my preceptor, Dr. Olma Sims, is to conduct public health research to advance health and well-being of individuals of Alabamians. The offered service is to train public health professionals in evidence-based public health practice. My internship project is the research about African American ethnicity, hypertension, diabetes, and arthritis independently predict co-occurring depression and obesity among community dwelling older adults Alabamians. As you know, obesity is a serious public health issue and chronic health consequences in older adults. Co-occurring depression and obesity may cause a reduction in the quality of life and increase the risk of morbidity for older adults. Also, the obesity and depression are quite common amongst the older adults. Surprisingly, public literature has not examined the factors associated with co-occurring. So the knowledge that fill the gap would be really helpful for clinical and public health professionals. During the internship, I will also found some difficulties since this is my first time to actually work in a real project. I need to work to analyze it and of the cross-sectional data and heavily relies cell report data. Now I can see the bigger view of the process and about the public health research process, every step and the purpose of them and the impact of the research on the society and to the public health industry. It was kind of new and complicated at the beginning, but with the dedicated guidance from my preceptor, I make it. I was kind of stressed because I only can meet and talk to him through email or Zoom call because we cannot meet in this time. But however, I think that's a really new and good experience, and I was so surprised that my reading and writing skill about scholar research and manuscript improved a lot. We believe that our product will successfully have some community impacts. We have figured out the prevalence and predictors of the co-occurring depression and obesity among older adults Alabamians, and beside that, the healthcare system and public health agencies can use the findings to inform intervention development. Going more details about my final products, here's the project description. The objective of this study was to estimate the prevalence of co-occurring depression and obesity among the older adults in Alabama, and identify the independent predictors of co-occurring depression and obesity among older adults. The study analyzed the data from Alabama Medicaid Agency Fund Long-Term Care Needs Assessment conducted by Comprehensive Center of Healthy Aging at UAB. It's called Charting the Course. We use the retrospective analysis, including the sample of community dwelling older adults living in Alabama, which was 1,166. We use the stratified random sampling design to make sure the proportion of the participants can represent the state population. We also use the binomial logistic regression to predict the co-occurring depression and opacity. Here's some research from the project. So we found that the prevalence of co-occurring opacity and depression among adults was 16%. The higher proportion of this co-occurring depression and opacity was female, African American, retired or unemployed. People have arthritis, hypertension, diabetes, and some symptoms of anxiety. You can see more information on table 1 on the right side. From the second table, you can see in the multivariate analysis, African American, hypertension, diabetes, and athletics was positively associated with co-occurring depression and opacity, whereas older age and higher level of physical activity were negatively associated with co-occurring depression and obesity. So the public health efforts designed to target and manage obesity among older adults cannot overlook the frequency of depression in the population. To reduce the morbidity and increase the healthcare in Alabama, there is an urgent need to identify older adults who have and who are at risk of co-occurring depression and obesity. So the project of this internship has met the requirement of public health research and 5 MBA's competencies. We believe it will make a greater impact on community moving forward and to the public health industry. Thank you.